Psoriasis is a chronic but a non-contagious skin disorder. But it's more than that. It's an autoimmune disease that causes the rapid buildup of skin cells. Patients will experience scaling on the skin surface, causing lesions and dry red patches. And studies suggest that more than 80% of people with psoriasis suffer from discrimination and humiliation. Today, we'll help raise awareness on this misunderstood disease, fight the stigma, and to separate fact from myth. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Joining us on the program are Dr. Lyra Laconico Tumalad. She's a dermatologist and head of the Psoriasis Center at the Rizal Medical Center. We also have Mr. Joseph De Guzman. He's the founding president and executive director of Psoriasis Philippines. It's good to have you both on the show. Now, as we mentioned, psoriasis is more than a skin disorder. Several factors play a part in causing this disease, including genetics. Now, I'll start first with Dr. Lyra. We want to explain how psoriasis is linked to a person's immune system.
So psoriasis is actually, as you mentioned, the new concept about it is that it's an autoimmune disease or an immune-mediated disease. So meaning there are certain immune cells that are dysregulated in this disease. So sila yung dumadami and nagkukos ng skin lesions which they may present as red, well-defined. We call them plaques, scaly, itchy lesions on the body of a patient with psoriasis.
Now, in general, the typical life cycle of the skin is about a month. Skin cells grow deep in the skin and then slowly rise to the surface. But someone with psoriasis has rapid skin production. Dr. Lyra, paliwanag natin yan. What happens beneath the skin of a person with psoriasis?
As you mentioned, it takes about a month for the cycle of the skin. Pero sa patient na may psoriasis, it just takes about a week or 7 days, nagpapalit na. So yung nangyayari is that nagpapatong-patong yung cells ng skin. So kumakapal siya. Those are the lesions that we see, yung mga mapupula. If you see a patient with psoriasis, may mga lesions siyang makakapal na mapupula. So they're inflamed, they're thick, and they're scaly.
Yun ang dapat paliwanag sa mga viewers, Dr. Lyra, because yun ang unang-unang nakikita ng mga tao with someone with psoriasis, yung redness and the appearance of lesions. So could we explain what causes that appearance of these lesions and yung redness?
Underneath the skin, there are dilation of the blood vessels. So yan yung nagkukos ng redness, and the inflammation itself causes the redness. And yun nga, sabi ko, there's hyperproliferation. So yun yung nagkukos ng pagkapal ng skin, nung balat, nung lesions ng patients with psoriasis. And scaly siya, so flaky or scaly kasi nga nagpapatong-patong na yung skin. So instead na mag-shed off siya, nandun pa rin, so nagkukos yun ng pagkapal. And yung nakikita nating scales or flakes na tinatawag.
Okay, and despite all of what people may see, none of these are contagious. And the symptoms of psoriasis may come and go, but the best way to avoid having flare-ups is to identify what triggers it. Now, it may not be the same for everyone, and it may change over time. Now, Mr. De Guzman, let's talk about the most common triggers. Unahin natin ang mga hormones. What happens here?
Common psoriasis triggers include infections such as strep throat or skin infection. The weather changes, extreme weather changes. Stress is the most common. Smoking and exposure to secondhand smoke, alcohol, certain medications, including lithium, high blood pressure medications, and anti-malarial drugs.
Now, Mr. De Guzman, binanggit nyo ang stress. Why does stress cause psoriasis to get worse? Gaano ka lakas na trigger ba ang stress with psoriasis?
Stress and psoriasis, they go hand in hand. Stress causes psoriasis, and the severe psoriasis you have, it causes you stress. It's a vicious cycle that has to stop. We have different forms of stress. You have emotional, you have physical.
So any form of stress can be a trigger. What about alcohol and tobacco naman, Mr. De Guzman? Are they triggers as well?
Oh, yeah. There are a lot of studies that shows that alcohol and cigarette smoking trigger psoriasis. There are even some studies lately that shows that they can even exacerbate lesions.
Okay, now there are also certain types of medications, medical and weather conditions that can make psoriasis worse. Now we want to discuss that, Dr. Lyra. Could you please explain to our viewers a little bit more on this?
Psoriasis may be genetic. So meaning it's just not one gene, but they said it's polygenic. No? So there are a lot of genes that cause psoriasis to come up. But then, hindi lang kasi genes yung factor. There are also environmental factors. So these factors are the ones already mentioned by Sir Joseph, no? And also weather changes can be a factor, no? Tama po yun. And stress. Kasi whenever we're stressed, di ba, yung body natin, there are disruption in the hormones, no? So pati yung mga other cells in the body are also disrupted when we're stressed. So kasama yun lahat, causing the inflammatory reaction in the body, now triggering the psoriasis.
Now, when it comes to the weather, Dr. Lyra, no? When it comes to the weather, can sunlight be a trigger for psoriasis?
Well, actually, sunlight, or we call phototherapy, is one form of treatment for psoriasis. So sunlight can also be good for psoriasis. We call it heliotherapy. We actually advise some of our patients to expose themselves under the sun in moderation. So hindi yung talagang peak ng sunlight, but
Okay.
we ask them kung kaya, no, before noontime, they can expose themselves under the sun. So it's also a form of treatment for psoriasis, but too much sun exposure can also trigger psoriasis. So bawal din yung masobrahan to the point na nasa sunburn sila.
With the naked eye, we only see psoriasis as those red, flaky patches on the skin. However, these lesions can actually lead to other complications, especially if psoriasis is left untreated. Dr. Lyra, can you explain this?
It's a multi-system disease, meaning the inflammation is all over the body. It's not just the skin. So that chronic inflammation, meaning yung pangmatagalan na inflammation sa katawan ng tao, can cause other diseases. So one, it's related to psoriatic arthritis. So a patient with psoriasis can have arthritis as well. Number two, it can lead to cardiovascular diseases, or it is linked to cardiovascular diseases. So this includes yung hypertension, atherosclerotic disease, no, yung pagbabara ng mga vessels natin. It's also linked to diabetes. It can also be linked to metabolic syndrome, no, ito yung overweight or obesity.
Now, Mr. De Guzman, most patients with psoriasis feel that they're stuck in a vicious cycle that they can't get out of. And this usually causes emotional distress. How do you address the psychological burden of someone with psoriasis?
Counseling is very important for patients. We have a program in Psoriasis Philippines which is called SOR Coach program, wherein we train patients themselves to guide newly diagnosed patients in their journey of psoriasis.
Okay, now stress is a part of life, but it worsens psoriasis. When we return, how to manage and cope. You're watching Med Talk Health Talk, your partner in healthcare. High amounts of stress can trigger psoriasis, but learning how to manage stress well can reduce and possibly prevent flare-ups. Welcome back to Med Talk Health Talk. I'm Dr. Freddy Gomez. Now, living with psoriasis can be quite stressful, and to add to that, the stigma associated with it can be overwhelming. Mr. De Guzman, please share with our viewers the other aspects of psoriasis that contribute to their burden.
The saddest part of having psoriasis is not knowing anybody who has it. It feels like you are left all alone and nobody seems to understand you, not even your family.
And the hard part is when people look or stare at someone with psoriasis, lalo na kapag may lesions o kaya ay redness ang problema. And the problem is it's not possible to explain to everyone that you're not contagious. Now, still with Mr. De Guzman, what role do support groups play in lessening the burden or stress that psoriasis brings?
I think the biggest role that Psoriasis Philippines has done for the patients is to advocate for them, We even push for the rights of persons living with psoriasis. We do consultations with the patients. We even do pep talks through our SOR coaches. We try to give them hope because that's very important for patients not to lose it. You know, the treatment of psoriasis is very difficult. A lot of patients give up because when they don't see any improvement on their skin, they totally give up their treatment and medication. They stop seeing their doctors. And, you know, it's very important for them to know that there is really not single treatment that will fit everyone. It's just a matter of be patient in your treatment.
And what we eat also affects psoriasis patients. And the best advice is to eat a healthy diet with lots of fruits and vegetables, lean protein, and whole grains. Now, Dr. Lyra, are there other types of food that can help fight inflammation or the flare-ups of psoriasis?
As you mentioned, it has to be a healthy diet, and it's usually composed of our fruits, our vegetables, and as you mentioned, lean meat and fish, no? So those that are rich in omega-3 fatty acids can actually help decrease the inflammation. So ito yung mga pagkain na we usually recommend our psoriasis patients, and avoid fatty food and those that are rich in sugar and yung processed food or processed meat. So ito naman sila yung nagkukos ng inflammation. So yun yung mga i-avoid natin.
Let's talk about sunlight. Earlier, we identified it as one of the triggers of psoriasis, but one of the mainstays of psoriasis treatment is phototherapy, which is a type of medical treatment that involves exposure to ultraviolet light or UV light. Now, my question for you, Dr. Lara, is how does this happen? Kung UV or sunlight is one of the triggers, but one of the mainstays to treat this is sunlight. Could you please discuss this with our viewers?
So as you mentioned, Freddie, no, it's what we call phototherapy. So it's para regulated UV light exposure. So we just got a certain sunlight ray or sunlight UV spectrum to treat the disease. So yung spectrum na yon, it's causing immunomodulation. Itong UV light na ito will cause modulation of that immune cell dysfunction. No, so ito ay parang in a form causing the cells to decrease in number para ma-normalize yung inflammatory response in a patient with psoriasis.
And although treatments can't cure psoriasis, many medications make the disease very manageable. Now, Dr. Lyra, can psoriasis patients have clear skin, totally clear skin with no marks or redness whatsoever?
It's actually achievable, no, to have clear skin, to have, let's say, 90 to 100% improvement in the lesions.
Now, psoriasis responds well to various treatments depending on its severity. Now, still with Dr. Lyra, let's discuss the more common effective treatments available.
So for the treatment of psoriasis, it's actually there are wide array of options, no, we have in the market. So if it's just mild, we give topical treatments. We have the steroids and all of these. So may ibang patients, topical pa lang, pinapahid pa lang, effective na. So nawawala na yung lesions if they're just mild. Yung iba, we subject them to phototherapy as we mentioned earlier, and some patients really respond very well, no? Talagang nawawala yung lesions, they dry up. But some, those that are on the moderate to severe side of the spectrum, sila yung mga kailangan ng mga iniinom or oral treatment. Ito yung mga immunosuppressants sa tinatawag namin. All of these are effective. It's just that we have to categorize the patient first, if they're mild, moderate, severe, and what would we think would work best for them.
Now, follow-up question, Dr. Lyra, is psoriasis a type of an ailment that is it something that they can handle on their own?
Well, actually, we still recommend that patients with psoriasis see their dermatologist, no, or other specialties if needed. It's a chronic disease, so you need to regularly monitor our patients, so see them regularly. Although these home remedies can help, can help decrease flares, can also work hand in hand with the treatments we're giving. So this includes proper moisturization of the skin. It also includes the diet, the regular exercise, the regular proper sleep, etc. So these are the things that will help our treatment give benefit to our patients.
Psoriasis often requires lifelong management with a certified dermatologist, and even with the best care, flare-ups can suddenly happen and disrupt your confidence and well-being. And as frustrating as this can be, there are things you can do to better cope with this condition. More on this when we come back. Psoriasis is a chronic autoimmune disease that can't be cured. And over time, your doctor will find what works best for you that will help minimize the symptoms and maintain the highest possible quality of life. Psoriasis can also take a toll on mood, self-confidence, and even relationships. But daily habits can help you deal with this. Dr. Lyra, do you have any tips on how people can manage with psoriasis?
We usually also advise our patients on, the daily habits. When we give them medication, after that, we advise them on how to cope with the psoriasis and decrease flares. So one is, as mentioned, they have to have a proper diet, healthy diet, avoid foods that will cause inflammation, processed food, too much sugar should be avoided as well. Alcohol and smoking, as we mentioned, there are proven risk factors for psoriasis, so we have to avoid that. Proper and regular exercise can also help. And as mentioned by Sir Joseph earlier, manage your stress. Stress is really a trigger for psoriasis, so you have to manage it. Know your limitations. Don't stress yourself too much, have proper sleep, avoid scratching, lesions, and also manage the itch. So we do advise them some forms like cold compress, baths with oil, so things like that, just to avoid the flares and also enhance their improvement of their skin.
And living psoriasis can be tough, not just for the one experiencing it, but for their loved ones too. Now, Mr. De Guzman, do you have any tips for family and friends living with someone with this condition?
Yes, I think the first thing that the family has to do is to understand what psoriasis is. And, they don't have to be pushy. They have to ask what the patients need. They should not presume what the patient wants. This is very important.
Right. And speaking to other people with psoriasis can be helpful as well because they understand what you're going through better and they can offer support. Now, still with Mr. De Guzman, what support groups are available here?
Okay. We have the national organization which is called Psoriasis Philippines. Under Psoriasis Philippines, we have different chapters and affiliations nationwide. We have around 11 training institutions who has a psoriasis support group. One of them is the Rizal Medical Center, PGH, and so on and so forth. We also have nurtured community-based organizations which really talks to their LGUs for provision of their medications and treatments.
Okay. And for Dr. Lyra, before we go, are there institutions here in the Philippines that specializes in the treatment solely of psoriasis?
As mentioned by Sir Joseph, we in the Philippine Dermatological Society has 12 training institutions. So all these institutions actually have their psoriasis units. So we are all capable of treating psoriasis because it's really part of our training.
Okay, and with that, we'd like to thank our guests, dermatologist Dr. Lyra Laconico Tumalad and Executive Director of Psoriasis Philippines, Mr. Joseph De Guzman. Psoriasis does not cause social exclusion, discrimination, or stigma. It's the reaction of people. And while it is not contagious, many patients are excluded in healthcare settings and daily life. Now, we all have a role to play in fighting the stigma and making life better for those who suffer from it. And it all starts with you. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. Stay safe, everyone.